HIV virus. You might be looking at the slide. That is the HIV virus. HIV is the acronym for Human Immunodeficiency Virus. So this is the short name of the virus, Human Immunodeficiency Virus. This virus belongs to a group of viruses, to the family of the viruses, which is known as the retroviruses. And the group is called the retroviruses. Now the word retro, the retro word RE is derived from the reverse, and TR for the transcriptase. So the retro means the reverse transcription, the virus which causes the reverse transcription. Because this virus, HIV virus, contains the reverse transcriptase enzyme. There are the few viruses which have this enzyme, the reverse transcriptase, and one of the virus is the HIV virus, and the second virus is the hepatitis B virus. So these are the two viruses which have the reverse transcriptase enzyme. As you might be knowing that mostly the transcription is that from the DNA the RNA is formed, but in case of the reverse transcriptase, from the RNA DNA is formed. So this is the reverse transcriptase. When from the DNA, from the RNA, the DNA is formed. This is called the reverse transcriptase. So this virus has the reverse transcriptase, and HIV virus causes one of the syndrome which is known as the AIDS. Now, what is the AIDS? AIDS is the acquired immunodeficiency syndrome. There is a difference between the disease and the syndrome. When the different signs and symptoms occur in different diseases, that is called the syndrome. So the HIV virus causes the syndrome which is known as the acquired immunodeficiency syndrome. You might be looking at this word, and this virus kills the T lymphocytes. It kills the T lymphocytes. So this is a cytolytic. Another group of the viruses which belongs to this retrovirus is the HTLV, human T-cell lymphotrophic virus. Human T-cell lymphotrophic virus, and this does not kill the T cells, but it immortalizes the T cells. Means there is the uncontrolled proliferation of T cells. So this leads to the carcinoma. the lymphomas or the neoplasia. So HTLV causes the HTLV1 type 1 causes the adult T cell lymphoma leukemia. So the HTL1 causes the adult T cell leukemia lymphoma because HTLV causes the uncontrolled proliferation of the T cells. It immortalizes. That doesn't kill the T cells. Another disease caused by the HTLV1 is the tropical spastic paralysis. So these are the two viruses, HIV and HTLV, which are included in the retrovirality. The HIV virus is RNA enveloped virus belonging to the retrovirality family, and subfamily is the lentivirus. And this HIV virus causes the slow infection, and it has the prolonged incubation period. This is one of the virus which has prolonged incubation period. Likewise, the hepatitis B virus, that is also the increased incubation period, prolonged. However, the HIV has the prolonged incubation period more than other viruses. The few names of HIV viruses which were previously HIV virus was called HT cell lymphotrophic viruses. Another name for in the olden days in the history, the other name for the HIV was the human T cell lymphotrophic virus. The next name is also associated with the HIV viruses, and that is called the lymphadenopathy associated virus. And the third is the AIDS associated retrovirus. So these are the different names or the former names of the HIV virus. So you shouldn't confuse yourself. These are the different names of the HIV virus. The types of the HIV. There are the two types of the HIV virus, type 1 and type 2. The type 1 is found globally, and it is worldwide. It has the worldwide spread. And HIV-2, that is found in the West Africa, and this has the less tendency as compared with the HIV-1 to be transmitted. So it is less transmissible than HIV. So these are the two subtypes, HIV-1, HIV-2. The other HIV subtypes, these are called the clades, and these clades, they are different clades. They are based on the difference in the glycoprotein 120. This is a glycoprotein. This is an antigen, envelope antigen on the difference. On the differences in the glycoproteins, there are the different subtypes or the clades. The B clade infects the mononuclear cells, and it is spreads through the anal sacs. And other clade is the E clade, E subtype, which infects the female genital tract, and its transmission is through vaginal sex. So weak late sprays through anal sex, while the E clade is sprays through the vaginal sex. So these are the subtypes which are called the clades. The history, the AIDS, the first time the AIDS was noticed, the homosexual males and with the Kaposi sarcoma in 1980. And the HIV was discovered in 1983. So, and this has the worldwide distribution throughout the world, and this virus also emerged in the Sindh, the few months before the Larkana district. So many cases were emerged in the Larkana district of Sindh. So this is the history of spread to different countries. The morphology of the HIV virus. They are the four structural proteins 1, 2, 3, and 4. And these structural proteins are number one, the group specific antigen. This is called the GAG. Group specific antigen, GAG proteins, GAG antigens, and ENV, that is for envelope, and this gene encodes for these two proteins, the glycoprotein 120, glycoprotein 41. And this HIV virus also has the polymerase enzyme, polymerase enzyme along with the other enzymes, the integrase and protease. So this gene, Pol genes encodes for reverse transcriptase, integrase, protease. So these are the retroviral genes of HIV. HIV virus has the retroviral genes which encode for the different proteins, and the most important is the protein 24, and this is a nucleocapsid core antigen. And this has the serological, this one is the serological marker. So this doesn't vary, its structure doesn't vary, and so it is important for the serological diagnosis of the HIV. This is the structure of the HIV virus. This is the nucleocapsid, and these are the envelope proteins, GP, glycoprotein 120 and 41, and the nucleocapsid protein here. This one is the GP20, the P24. This is the RNA virus, the genome of the RNA, the HIV virus. So this shows the virus shows the different proteins and antigens which are helpful for the diagnosis of the HIV infection. The modes of the transmission, the most favored mode of transmission is the sexual. So primarily the mode of transmission in the 60% of the HIV AIDS cases is the sexual mode of transmission, and the risk of transmission of HIV increases when there are the sexually transmitted disease already present in the patient. if the patient is suffering from the sexually transmitted diseases with the ulcerative lesions. As you know, the ulcerative lesions on the genitals occur in the syphilis, which is caused by the Treponema pallidum. Another sexually transmitted disease, STD, is chancroid, and the herpes genitalis is a viral infection, and the chlamydia also cause the STD, the sexually transmitted disease, and the gonorrhea. So if the sexually transmitted disease, a lesion is present in a patient, it is at the high risk to be infected, to contract the HIV virus. Another way, the second mode of the transmission is vertical transmission in the 30% of the cases. In the 60% of the cases, mode is the sexual, and in 30% of the cases, there is a vertical transmission, means the transmission from the mother to their offsprings. And the vertical transmission may be of any type, the transplacental, it may be the transplacental, and it may be acquired by at the time of the perinatal period and during the delivery, and it may be acquired by the breastfeeding. So this is the vertical transmission includes these three modes: transplacental, perinatal, and the breastfeeding. Third way of transmission, mode of transmission, is the parental. In the parental transmission, mostly those which use the drugs, IV drugs, they are at the increased risk, and also by the transfusion, by giving the blood products or the transfusions through these blood products and the transfusions, the HIV virus can spread, can infect the other person. So the transmission is much similar with the hepatitis B virus. However, there is a less efficiently transference of HIV. The infectious dose as compared to the hepatitis B virus is much larger, while the infectious dose in hepatitis B virus is much similar. The targets, the targets which the HIV virus targets sites or these cells. The HIV attaches to the host cells, and the receptor for the HIV virus is the CD4 antigen, which is present on the different cells. So the CD4 cells, CD4 antigen is the receptor, and this is found on the different cells, blood cells. So remember, the most important, the CD4 T cells, or they have the affinity for the HIV virus. So the helper T cells, CD4 T cells, are the mostly infected, and the macrophages, monocytes, B cells, microglial cells, and dendritic, and these different cells are the targets sites, for the HIV infection. This is a life cycle, how the virus infects and then enters into the cells, and then the transcription occurs. These are the generalized steps of the life cycle of different viruses. So the HIV also follows the same steps which are followed by the different viruses. The attachment, the fusion, then the reverse transcription, integration, assembling and budding. These are the ways, the steps which occur in the HIV infection. The incubation period for HIV is 6 to 12 weeks. So I am describing the early. This is not EA. This is a involuntary mistake. Early or acute stage. In the after the incubation period, which is a 6 to 12 weeks, even the months to years. So this is a prolonged incubation period as compared to other viruses. The symptoms appear in this stage, the early stage, in the acute stage, or the fever, lethargy, and pharyngitis, and the lymphadenopathy is an important predictor of the acute stage. So the sore throat, lymphadenopathy, and the rashes on the different parts of the body, and the headache. So these are the symptoms are the signs which occur in the acute stage. Seroconversion. When the HIV antigen is absent, but the HIV antibodies are present, this is called the seroconversion. When the antigen disappears and the antibody against that virus appear in the blood, this is called the seroconversion. And those who are seropositive, 87% are asymptomatic. When the patient is a seropositive, means it has the HIV antibody test positive, 87% are asymptomatic, and 13% are the asymptomatic at the time of the antibody test when it is positive. The third stage is chronic or the latent stage. Remember that in the AIDS is has got the latency. As you know, there are the various viruses which have the latency period, and the HIV is one of them. It has got the latency period, the chronic stage, and there is a low viremia. Patient is asymptomatic, and patient doesn't care of these symptoms, and so the disease lingers on. It is going on asymptomatically until the last stage is reached. So this virus has got the latency. The last stage is the AIDS, the full-blown syndrome of HIV infection is called the acquired immunodeficiency syndrome. And when this syndrome occurs, the CD4 lymphocytes, the helper lymphocytes, they are lower, they are lower than the 200 cells per microliter. So the lymphocytopenia occurs and the lymphocytes are CD4 lymphocytes are less than 200, and this step the AIDS occurs. In the AIDS, the CD4 lymphocytes they are decreased, and the opportunistic infections occur at this stage in the AIDS. There's so many opportunistic infections. These may be the viral, the parasitic, the bacterial. So the every microorganism gets to infect the immunocompromised patient, because the patient of HIV, the HIV patient is immunodeficient. So the different viruses and the parasites and the fungal infections occur. So this is acquired immunodeficiency syndrome. CD4 count is less than 200, and the opportunistic infections are present, and these opportunistic infection, in case of the fungal infection, the oral thrush occurs, oral candidiasis occurs, and in case if the opportunistic infection is the bacterial, the Mycobacterium tuberculosis, other atypical mycobacteria infect the patient, and among the viruses, the zoster, the herpes zoster infection occurs, and the parasitic infections also may be concomitantly present along with the other opportunistic infections. This is the oral thrush, the oral candidiasis. This one is the throat. You see there is the pseudomembrane, in the pharynx and throat. So this one is the oral candidiasis. This has inflicted this is the leukoplakia of the tongue. The leukoplakia of the tongue, and this is associated with the Epstein-Barr virus infection. And this is not a pseudomembrane like the candidiasis. This cannot be scrubbed out. This cannot be rubbed off. So this is a leukoplakia. This is not a pseudomembrane. This shows the viral infection, which is known as the shingles, and the herpes zoster. This herpes zoster is mostly the unilateral. So this is present on the only one side, and the vesicles has appeared, and the nerves, they cause, this is acute stage, and later on this becomes resolved, and the neuralgia occurs in the later period. So this is a herpes zoster. These are the opportunistic infection of different opportunistic infection. Now shifting to the diagnosis of the HIV, how we can diagnose the HIV infection. The one of the laboratory test is the HIV antibody against the HIV virus. So the HIV antibody against the HIV antigen, and these are antibodies, HIV antibodies. They are detected by the method which is known as the enzyme-linked immunoassay, immunosorbent assay, ELISA, and this and the aura quick rapid test. This is a rapid test, and this is performed on the oral swab. The oral swab is taken, and this is treated with the substance which is present in the kits. So this is a kit method, and this method, aura quick rapid test, is a point of care test that can be performed at the bedside of the patient, and the results are available within 20 minutes. So the aura quick rapid test is useful for the diagnosis of HIV infection. If the HIV ELISA or the rapid test is positive, and the test is followed by a confirmatory test which is known as the Western blot immunoblast assay. So This is confirmed if the ELISA is positive or the aura quick test is positive. This is followed by a confirmatory test, which is known as the Western blot test. The most important is the HIV P24 antigen. This has the diagnostic value, and this is much important, and this is performed in the acute stages. This in the early stages of HIV infection, this is an antigen which is elevated in the acute HIV infections. So these antigens are detected. The HIV, for the HIV infection with the polymerase chain reaction, the PCR is also performed to confirm the HIV. In infection, the viral load is assessed in the PCR. So there are the different various laboratory tests which are performed in order to diagnose the HIV infection. So the CBC is performed. The routine tests which are performed in the HIV suspected patient, the person who is suspected of AIDS, the CBC is performed, HIV antibody test is performed, and by the PCR, the viral load is detected, and the other concomitant infections, for the concomitant infections, different tests are performed, such as the hepatitis B virus, hepatitis C virus. Uh, they are also screened, and the tuberculin skin testing is also performed because the mycobacterial infections are common opportunistic infections. And the pap smear, in case of the females, the pap smear, the cervical smear is assessed for the for for the changes, for the smear is taken, and the test is performed. And for the other sexually transmitted diseases, the the other tests are also performed. If the case is female, the the test that is known as the torch. Remember the torch. TO for the toxoplasma, R for rubella, C for cytomegalovirus, and the H for the herpes simplex. So during the pregnancy, if the female is a pregnant, the torch is performed. This is one easy test which includes the screening for the different diseases, toxoplasma, the rubella, the cytomegalovirus, and the herpes. The prevention is important for the it is important to have a safe sex, and the preventive measures are taken. The needles which are contaminated, these needles in syringes, contaminated needles in syringes, they are avoided, and in case of the pregnancy, the cesarean sections are performed. They are they are performed. The cesarean section of the female which is pregnant and at the last stage of last trimester of the pregnancy, and the advising to all HIV positive women to breastfeed. Breastfeeding cannot be stopped. However, through the breastfeeding, the viruses, the HIV virus spreads. So the And lastly, the treatment. Treatment is the antiretroviral therapy, means the drugs which are against the retroviruses, they are given, and they are beneficial in some cases. And this is the antiretroviral therapy, which is called the HART. The HART is a short form of highly active antiretroviral therapy. So what is the HART? HART is a therapy, antiretroviral therapy for the HIV virus. And these are the different antiviral drugs. Thank you very much for listening. Yeah.
End